bit of a different story, not kind of the traditional entrepreneur, tech, startup founder. But I'll tell you a little bit about kind of what we do and some of the lessons I've learned as a kind of non-traditional entrepreneur. Oh, it's still me. Okay, so firstly, I'll just say, Omar, you took a lot of my presentation, which is interesting because it means there's obviously a lot of overlap and we kind of feel the same way, which was, and I like your slide about the founders are not happy because, you know, it's one of those things. So yeah, I'll tell you a little bit about HealthCasa and what we do. We're not a household name yet, unfortunately. It takes time, as Omar mentioned as well. So basically, we provide in-home healthcare appointments. So, you know, if you woke up one day and you had a backache or a neck ache and you needed to see a physiotherapist or a massage therapist, the typical situation is you would go to a healthcare clinic and see a provider at that clinic. What we do is we bring the services to you in the home, in the office, in the hospital, wherever you are. So that you don't need to go and find those services and, you know, sit in a car and sit in traffic and sit in waiting rooms. So that's essentially what we do, and we see clients of all ages across Ontario, and we've been doing this for a couple of years now. So, and I'm going to go straight into kind of the lessons learned, and through that you'll kind of learn a little bit more about me and where we've been and, you know, where we're coming from. So I really like this quote. It's really about kind of being open to opportunities. People always ask me, you know, how did you know you wanted to be a tech founder, an entrepreneur, you know, a health tech startup, whatever? You know, the short answer is I didn't. I started off as a dentist in Johannesburg in South Africa, like a purely clinical role. I went to medical school. I worked in a dental practice for many years. Moved to Canada, came to Rotman, was very much immersed in like healthcare consulting, healthcare strategy. I was going to be a healthcare consultant and be an employee and work for somebody. And then an opportunity came up and I met my co-founder, Mike, who's in the front row. I met, you know, the right people. It was the right time. The opportunity presented itself and, you know, it just made sense. We had the same vision. And there we go. So you just never know where, you know, something comes up and you meet the right people and you kind of get going. This is another big one. So it's about change, and Omar kind of mentioned this as well. For us, COVID was like a big event for us. You know, when you start a business, you need to know what you're doing. You need to know what your business is and what your positioning is and who your market is. But you need to also be ready to change. We were one of those businesses that had to essentially close down during COVID for a couple of months. We started off actually focusing on the corporate space, so offering appointments in big law firms, accounting firms, etc., across Toronto. You know, fast forward to March 2020, when offices closed, employees were sent home for 2 weeks, and we all know kind of how that ended. And we had to change. We had to pivot. I hate that word pivot, but it's what we had to do. And we had to change quickly, or I wouldn't be standing here talking to you about HealthCasa if we hadn't. So, you know, things will happen, you know, hopefully not another COVID situation, but things happen all the time. In healthcare, there's changes in insurance and policy and regulation, and that's across all industries. So, you know, be ready for that and be open to that and be ready to make changes quickly because things are going to go wrong. Like, that's just what it is. Founders are not happy, as Omar said. Again, it's not supposed to be easy. You know, when we first spoke about this idea and we came up with this idea for HealthCasa, it seemed like such a simple idea. Like, why wouldn't it make sense that, you know, your physiotherapist, your massage therapist, your dietitian, your whatever comes to your house rather than you traveling to see them? You know, simple idea, but it's all about the execution and the endurance, and it's not easy. And tech's not easy. And we learned that the hard way as well. We, you know, went right into building a tech platform, not really knowing what our business was, who our user was, what we were building, why we needed all those features, who we were building the tech with. So nothing is easy. Like nothing is as easy as it seems. And if it was, everyone would be building businesses and having huge exits all the time. So kind of keep that in mind. I think Omar mentioned this one as well. Entrepreneurs wear many hats. Yeah, like in one day, I'm looking at legal contracts. I'm looking at financial models. I'm looking at marketing. I'm speaking to our tech developer. I'm doing QA on our new tech platform. I'm just a dentist from South Africa. Like, I don't know how to do half of this stuff. So sometimes it's a bit of like fake it till you make it. Hopefully none of our investors are in the room. But, don't let the lack of experience and the lack of education in something, stop you from figuring it out. And, especially with technology, with YouTube, with ChatGPT, with everything that's accessible, you can figure out a lot of these things. You don't need to be a lawyer, an accountant, a tech developer to kind of figure out a lot of these things as you go. And lastly, just kind of get started. It's sometimes, obviously you need to know your business, you need to do the research, you need to figure out the market, you need to figure out, the landscape, the competitors. You need to do all of that research before you start a business. But you can also kind of drive yourself crazy just researching and analyzing and thinking and building and adding features to the tech. And sometimes, and we made that mistake, I'll admit it. We spent a long time kind of figuring things out, building the technology, and then kind of starting. Especially with us, we were a two-sided marketplace, so we needed patients and we needed providers as well, and needed to be in the same city and, matched up accordingly. So at some point, if you have an idea and you've figured out the landscape, you just have to start somewhere, get your MVP, figure it out. If you can use a off-the-shelf technology, use it. You don't need to go and spend millions and millions and millions of dollars, like right off the bat, building something, find your first user, find a customer, sell your first product, get feedback, iterate, and then kind of keep going. But, at some point, you've got to just get in there and start. I think that was it. Yeah. So that was it. Happy to answer any questions.
Thank you.
And thank you.
Let's get a round. Stay up there for questions. Questions. Let's see, Riley. So I'll start.
Just wondering how you found your first, because yours is kind of similar to mine, where you're kind of like an aggregator. You have one patient on one side and one, I guess, provider on the other side. How did you go about finding the left and the right?
Yeah, good question. And it's something every day we're trying to figure out. How do you get the left and the right, and how do you have enough of the left and the right? Yeah, we started, again, it's just starting small, right? We started with one provider in one service in one little tiny area in downtown Toronto. And we literally went to friends and family and we're like, do you need orthotics? We have someone who can do that for you. And so you've just got to start. You've just got to find, patient A. And, hopefully patient A is a friend of yours. So if it's really bad, they're not going to write a bad review. Yeah, you've just got to find that like first group of users. And yeah, we still remember very clearly who those first users were. We had a handful of them and it didn't all go as planned. And then, the next round was better. And then you just keep going. And yeah, now we're, hundreds of providers and thousands of patients, and you've just got to start with one.
Hi, I have a question regarding why did you choose Canada over other jurisdiction like the US, who has the same demand? And also, just a follow-up on that is, what's your scaling strategy?
Yeah, okay, so I'll do the first one first. So I will say I didn't choose Canada for the business because, as I said, this wasn't on my radar at all. I didn't kind of intend to move to Canada to build a business to start this at all. For various personal reasons, I left South Africa and then came to Toronto and kind of knew I wanted to do something outside of dentistry, knew I didn't want to be in that space. And it was an opportunity to do something different. And, after doing a lot of research and chatting to a lot of people and trying to figure out what I wanted to do, kind of landed on the MBA here at Rotman. And, Toronto was obviously a great place to do that MBA. And and then I was here for the next 2 years. And then here I am.
One last question, Riley. Do you have someone?
Yeah.
Thanks a lot. So I assume in your business, you are mostly working with physios, chiros, and RMTs. And although they are saving a lot on not paying for real estate, then again, for the time and just making the travel and stuff. So there is still some margin there. So my thing is I'm working on helping this professional save some time there. I don't know if you guys are working on it as well, but do you think we could have some collaboration and you guys be our design partner?
After.
Yeah,
For sure.
okay.
That's how you get your first customer. Be aggressive.
Thanks.
Cool. Can we get a round of applause for Karen, please?